It's tricky. They usually come in a pair, but these we actually have, especially when you use multiple ones. You'll have open one with an introducer, and then the other ones don't need to have an introducer because this is interchangeable. So it's just a cheaper method. You can obviously you can't interchange this with only with the 5 the same kind. So introducer in, boom. Make sure the port is closed so the gas doesn't leak out, right? And then here, I don't want it. Okay. So now I have this. I'll take the bag. Thank you very much. And this one. Where's my camera? I can't see what I'm doing. Camera, please, assistant. All right. So got the ovary. So I am gonna Good. I just want to put it down.
So we just put the ovary right there, right?
So basically, the way the bag works.
Okay.
I'm gonna go out. It's gonna be inside the belly. You're gonna open the bag up. I'm gonna put the ovary into here, like in the body. You're gonna close the bag up. There's a string here that they cut off, and then that's gonna have the bag right here, and there's a string with the bag, and this comes as removable. Comes out. There's nothing on that. It's just something you throw away, like basically what it looks like now, right? The bag is inside with the ovaries with the string attached. Now. The string that comes out through the port, right? So now I have a string, I don't have an ovary. I have to get the ovary out. So I'm gonna probably take that bag right up through this port. But I'm not gonna take it up through this. I wanna take it up through this. So what do I need from you right now? Yes, good. I need to take this down. You can also take this down with a clamp or anything. All you need to do is just push into right here. But I always will have this ready for them because I know they're gonna be doing it. So. At the time, if I'm taking this out, what would I probably do to make this whole process easier?
Remove the gas.
Right, I'm going to put the gas on to another port, which is totally fine, because I'm about to remove this, and then you don't want the gas to be hooked up to something to remove, because then there's no gas, right? So we're going to change the gas out. Deflate that balloon. At the same time, I'm making sure that that string doesn't fall back inside and go wandering away. String like this, and then look at the ovary. And I'm gonna go like that. All right, ovary. Now I'm gonna want to look back inside, look around. We're looking pretty. No bleeding. Everything's beautiful. Oops, except for that. And all right, boom.
I have a question.
Yes.
Now the ovary, the 10 ovary is right here.
Right, we're gonna
You
go
add
with
the
this.
section. Okay.
Yeah. So in the meantime, I take that ovary and I put it back here. I'm gonna focus on, that's not important to me, it's not anything immediate, it has to go.
Okay.
I wanna be focused on what they're doing, because all of a sudden they're gonna be closing real quick.
Okay.
So I need to be focused on this. I can handle over off when they're suturing, right?
Okay.
I'll have plenty of time then. So as long as it's back, my back table, I wouldn't leave it on my nail or anything. I'll just put it back here. It's gonna be in a bag, self-contained, it's all juicy. I'm not worried about drying out or anything.
Okay.
Throw it back there for now, I'm not even worried about it. No one's touching my table, right?
Okay.
So, in the meantime, this would probably actually already. So, all right. So now, okay, we're ready to close. This, what do I need to do? What are my steps? I'm done with this. Okay, what first? What should I be doing before you hand me the suture? I'm not ready for suture yet.
Take your ports
Before
out.
that, right. As simple as that. But what do I need to tell the circulator?
Gas
Turn off the
on.
gas.
Gas off. I'm also very concerned with this always. Turn the damn camera off. Get it done with. Go ahead.
I just
Yep.
turned it down all the way
No,
down.
turn the whole thing off. You can turn the whole machine. No, turn the, no.
This one.
Yeah, yep. Okay, then you turn the camera off. We're done with it. You can unplug them both. Just let it dry. It's fine. Just let it go. Just unplug it. That way, when I'm done, then I can just have it to me. But you can turn off the camera.
Left side, switch.
The green. The good.
No, top left.
You had it. The green. Yep. Okay. Off. Okay. Always, always, always leave the bovie on until your final closure.
Okay.
They can always hit something, nick something, and if that bovie is unplugged and not available, you will. It's a lot of trouble. So when I see that circulator come over and unplug it at this time, hell no. You keep that bovie plugged in.
Okay.
I'm actually saving your ass because they're gonna yell at you
Got
when
it.
it's unplugged.
Okay.
So please leave it plugged in. It's no big deal to unplug it 10 minutes later, right? I will let you know this because I don't have an actual bovie. Let's say when I was going in the Varus needle, I did nick an artery or something. There's a little bit of bleeding on the top skin, but when I had my port in, it wasn't bleeding or anything. It's not anything severe. And now I'm gonna go close, and I got this little bleed right here. I'm not gonna open a whole bovie just to do that. What can I do?
Take one of the, like the clamps and connect it.
Right,
to it,
usually
just
they
on
actually use the
outside.
Maryland. They'll take the Maryland and they'll connect the cautery to the Maryland and they'll just bzzz, and that's it. So I also never take our Marylands come apart. There's 3 pieces. I don't do that to the surgery. I can do that to my grafts and stuff, but I always do the Maryland together for that reason. I always want to make sure this is, good in case I need to use it. Don't turn the bovie off. I don't care. It's very important. Okay. This thing can sit here. I want to get this out of here, so I detach both of those. Put that back there. Yep, and I'll just get those out of my way. There you go. Until the end of the case, it can sit right there. Oh, yeah, I probably wouldn't even have it up here. I would just have it not taken apart. But in the same time, they need to put up your stuff. They're going to say suture, suture, suture. So it's all kind of one big movement at once. So you almost just got yourself on that suture. Do you feel that? Be careful. Okay. Now this is great. So instead of putting it right here, let's do it the right way.
And over.
Yep. Okay. This is great. I'm so happy I have the suture. Okay. I'm so happy I have this and this, but I can't really see anything because the fascia is down there. What do I need? What do I need to be able to visualize down deep?
The poker.
Yep. It's gonna be the same exact stuff to get in, to get out. Okay, so what else besides the pokers?
Retractor.
Right. What kind of retractors? Thank you. Okay, for my assistant now, we'll take those pokers. They don't always use the S's at the end as much, but they can, so I put them up there. 2 pokers. And you're gonna put those on the, underneath the skin, subdural, and kind of pull it apart so I can see down there. And a lot of times they'll actually use a Kelly instead of this because it's a little deeper, but this is, What do I need now? Lap is good, but it's
Scissors.
not a lap. What is it? Raytech? Right,
Scissors.
I'm gonna need scissors. You always wanna put your suture scissors up when they have suture because they're gonna need to cut it sooner or later, so. All done. Oh, go ahead, why don't you cut that for me? Can you cut that needle off, please?
Is this right?
Go ahead, I'll probably use it, that's fine. Okay, needle back, unprotected, okay? They're gonna tell you it's unprotected. But for the most part, they're gonna actually, like this, protected needle. It's a big communication thing. If they're putting sharps on your table and not telling you they're putting sharps on your table, you say something immediately. I need you, and you know what, the surgeon and the resident's doing it, and you say something to them, I need you to protect that needle, or let me know it's unprotected on my Mayo. Please do not leave sharps on my Mayo without telling me, and that doctor will rip into that resident for you. Because it's something they should know at this point, if they're sitting here for surgery and assisting, they should know, protect your surgical tech. So always know your voice, right?
Okay.
Alright, so now we're tying this. Okay. A couple of things, what should we be thinking about now as well? I definitely want that off my table though, right? No? What do you do with it?
I love it.
No, we're all done with it, right? So where does it need to go?
Sharps.
Right, in the sharps, which is there, right?
Take it off.
Right, you have to put it right in the number 1, right?
Okay.
You practice this, right? Putting it into the magnet pad. It's home. Right. At this point, if I'm playing around over here and they're tying it or whatever, I'll probably take my blade off. Okay, what else do we need to be doing as we're doing the suture though?
Counting softs.
Counting, right? Because we're starting to close. So it'll be our first closing count. So what do you have to do here? Circular, you need to count. And they know, when they turn the lights on, they know it's coming. So they should be actively, here for you. All right, let's do a count. At this point, the surgeon's gonna be like, see y'all. I'm gonna go dictate this case, go get my some coffee. Oh, there's one actually. And then the assistant and the tech will finish closing. If there is an assistant, if not, I see the surgeon will stay in and suture the skin. But the surgeon won't leave until the fascia is closed, that's part of it. Okay, so, labs.
0.
Okay, so if I would look at that whole spiel, yeah, I already know what I have now, so 4 by 8s.
That would be putting it in the bag or
Yep, but, so where was that one?
on the.
Okay, so why don't we leave it up there,
Okay.
because the assistant, so you be up there suturing, right? You're suturing. We didn't give you any skin. What kind of suture will you have for the skin? What kind of needle?
A reverse.
Reverse cutting. Most likely
A 4.0.
yep, 4.0. What kind of suture it was?
Vicryl?
Monochrome.
Monochrome.
Very good, very good. You just learned that. That's good. I don't know if we have it. Oh, jeez Louise. These are actually 3Os, but whatever. Alright, so why don't we load this and give this to Lynn so she has something to do while we're counting, right? Continue the case.
So we'll upload it for her.